Okay, time to baby your baby, and we have Nurse Danny here to talk a little bit about, she's from Intermountain Healthcare, to talk a little bit about sleep training. You can't train babies, Danny.
I know, some people do think that, but the beauty of it is that babies have like a 4-day reset in their brain, and anything you reinforce for that amount of time will become a new norm to them.
See, and we had our twins, and they were in neonatal ICU for a few days, and I just thought, well, I'm going to do what they did there.
Exactly.
And I think it worked.
Yeah, you get down a system, you try to enforce a schedule, but you should always talk with your pediatrician first before you try to figure out, like, when should I do this? There are times when they're too young. You need to make sure they don't need extra nighttime feeding. So how old? When should you start? Some experts say 6 weeks is, you know, the earliest. Others say 3 months. So as long as your baby doesn't have any medical problems and they're not too small and need those extra nighttime feedings, sometime between 6 weeks and 3 months is when you can start. Okay, and how do you start? Just by doing it. Crying it out is hard for parents to do. You just let them, you put them in bed and let them cry. Yeah, well, make sure they're fed, they're changed, they've been loved, and their sleeping environment is safe. And we kind of get to know our baby's cries. So if they're desperate and they're crying because they're in pain or have other needs, go check on them. But if it's just because they want you, up until this point they've learned that if they cry, they get what they want most, which is you. So you're teaching them how to self-soothe by making them cry it out. And sometimes that using that energy to cry is going to make them even more tired. Put them to sleep, right? And they'll fall asleep. Eventually, and just for 4 to 7 nights, stick it out, and everyone will be sleeping better soon. It will be a tough week, but there's a more graduated approach. You can just go in and gently touch them every 5 minutes, let them know that you're there, and slowly increase the amount of time you wait before you check on them again. And some parents find that that's a little more palatable to them. Yeah, because you worry. Yeah. Yes. And how can people get a hold of you if they have any questions? Facebook.com/Intermountain Moms. Intermountain Moms. Okay. Nurse Danny, thanks so much. Thank you.